The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. I'm your host, Denis Thompson, and today I've got some great news for those of you in the Miami Beach area. I will be at the FIME show at the Miami Beach Convention Center, and this is a convention of doctors throughout the entire world. So if you're a practitioner, come on in. I'd love to meet you. If you're a patient and would like to be treated, we have plenty of doctors there. I'd be more than happy to work with you and on you at the show. If that is of interest to you, please give us a call locally at 954-256-0045. I'll be one of the speakers at the conference. And I'll be introducing a topic that we're going to be talking about and have been talking about for probably the last, 8-9 weeks, and that is the ARP Wave System neurotherapy. So let's get right to it right away, and we have a lot of questions that we need to answer for the listeners today. But first off, let me give you a capsule view of what neurotherapy is. And it is not a new therapy, it's just simply a unique add-on therapy to the present therapy that we do throughout the world. Think of it this way. There are two distinct components of your system. There is a nervous system, which we will call the software for your system, and then there's your muscles and tendons and ligaments and joints in your structure, which we'll call the hardware of your system. Most practitioners today throughout the entire world work on your hardware, not your software. What neurotherapy does is it allows us to complete that cycle. It allows us to work on both the neuro side and the physical side. In other words, the software and the hardware. Now, my guess is if you've ever had a computer problem, you just didn't want to go to somebody who operates specifically on hardware, or you didn't want to go to somebody who just works exclusively on software, because if you bring it to a software guy and it's a hardware problem, they're not going to be able to solve it. And if you bring it to a software guy and it's a hardware problem, they're not going to be able to solve it, and vice versa. So doesn't that make sense that your practitioner, your doctor, your medical professional offers both sides of the equation? Neurotherapy, which addresses the neurological origin of the physiological symptoms, and, more importantly for you, the patient, wherever you have pain is where the problem ended up, not where the problem is coming from. And all the tests that we have available to us today tell us where the problem ended. None of the tests, other than the ones that we have created through the ARP Wave system, will tell you where the problem came from. And that is a huge, huge benefit to know where the origin of the problem is and not just to have to rely on the test to tell us where it ended up. So neurotherapy is a very, very unique therapy. And we're reaching out, teaching doctors throughout the entire world this therapy. So if you're listening to my voice today and you have pain, if you've been told you need surgery, if you've already had a surgery and it was unsuccessful, if you've been told you have chronic pain and there's nothing else you can do, if you have MS, if you have diabetic neuropathy, if you have a herniated disc, if you have any of those conditions, then you need to listen very carefully, because we're going to offer you, at no cost or obligation, the opportunity to see if neurotherapy can help you. Now, if we take away all the risk, we take away all the financial risk, we take away all the obligation, why in the world wouldn't you try something that might help you? If you knew beyond a shadow of a doubt it wouldn't hurt you. Well, the FDA has basically authorized the use of our tools, our proprietary tools, which simply means that the FDA believes that our tools, our techniques are safe and effective. So if you have a doctor, which I'm sure you do, when you get done listening to this program, please give your doctor a call. If they're in Miami Beach area, please give them a call and tell them that we will be at the Miami Beach Convention Center from Wednesday through Friday of this week. And we will be at the FIME conference, which is a large, large medical conference. And we would love to have the opportunity of treating you or treating your doctor to show both of you that this therapy should be a great addition to their practice, no matter what that practice is. Because keep in mind, this is working on a completely different paradigm. It's working on the software side of the equation. In other words, it's working on the nervous system. And your nervous system drives everything in your body, including your blood supply. So if you have pain, if you have restricted range of motion, please give us a call at 954-256-0045. And we'd like to invite you and your doctor to the convention center this week, and we'd be more than happy to give you a treatment at no cost, no obligation, to show you that this therapy can or maybe cannot help you. But there's only one way you're ever going to know, and that's to try it. And if there's no cost, there's no risk, there's no obligation, please, you've got nothing to lose. We're in business to see if we can help you. That's the only reason we're in business. Over the last 15 years, our company has treated over 75,000 patients all over the world as a provider with better than a 95% success rate. This year, we changed our entire business model, and we're setting up the nation's largest network of professionals to administer our neurotherapy to their patients. So if your doctor does not offer neurotherapy right now, and you're outside of the Miami area, when you're done listening to the show, give them a call. Tell them that you would love to be treated with neurotherapy, and the company will basically send to them either a representative or send to them all the proprietary equipment necessary to give you or the doctor's patients a free evaluation of our neurotherapy. The only way your doctor's going to know if it's going to help you, and the only way you're going to know if it's going to help you, is actually try a treatment. And no matter where you're at in the world, excuse me, no matter where you're at in the world, we have absolutely no problem getting you our system to give you the opportunity to try our system. Again, no cost, no obligation whatsoever. So that number again is 954-256-0045. Now, people constantly ask me, what is the difference between neurotherapy and physical therapy? And it's a very simple answer. Neurotherapy works on the neurological origin of all physiological issues. So in other words, wherever you have pain is where most people work at. That is not the origin of where that pain is coming from. It's simply the end point of where the pain ended up. What neurotherapy does is it finds out where the neurological disconnect is, allowing us to track the signal back to where the pain is ending up and basically get rid of it. Retrain your body to respond differently to a different stimulus. That's what neurotherapy is all about. It's very unique and very, very fast, because what we're doing is, again, we're working on the origin of the problem. We are not working on the problem. And sometimes that becomes very, very confusing. So let's say that your shoulder hurts, and you've been going to physical therapy or occupational therapy, and they've been working on your shoulder because your shoulder hurts. What neurotherapy will do is it will identify very quickly where the signal is coming from, which is causing your shoulder to hurt. And once we find that signal, once we find that pathway and get rid of it, more than likely your shoulder will not hurt any longer. Then what we have to do is retrain your muscles to be able to do what they should have been doing all along, which is preventing that force from coming into your shoulder. So listen carefully right now how you can try neurotherapy locally at no cost and no obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Dennis Thompson, and again, at the beginning of the show, I told you that I would be at the Miami Beach Convention Center from Wednesday through Friday of this week. If you are a medical professional, I would love to have the opportunity of meeting you. Just simply give us a call locally at 954-256-0045, and we will get you VIP passes to the show. That number again is 954-256-0045. So if you're a medical professional and are interested in neurotherapy, curious about neurotherapy, and would like to meet me, I would love to meet you. That number, again, to get your VIP pass is 954-256-0045. Also, if you're a patient, if you suffer from pain, if you have been told there's nothing you can do other than take medication for the rest of your life, if you've had a failed back surgery, if you've been told you need surgery, if you have restricted range of motion, I would love the opportunity of meeting you, showing you how neurotherapy can help you. And there's only one way you're ever going to know if neurotherapy can help you, and that's to try it. And again, I will be personally at the Miami Beach Convention Center Wednesday through Friday of this week, and would love to have the opportunity to meet you, answer any of your questions. And all you need to do is to get your VIP pass is call 954-256-0045. And again, that number, 954-256-0045. And I would love to meet you. So one of the questions that we had on email today was a long question from a lady out of Bozeman, Montana, if you can believe that, listening to the show in Bozeman, Montana. And this lady says that she has been diagnosed with diabetic neuropathy and would like to know if the ARP Wave System neurotherapy could help her. And this show is not designed to diagnose anything. I'm not a medical doctor. I am the developer of this system. We're not here to give free medical advice, but we're here basically to share information. And so what I can do to answer this question is share how successful we've been with diabetic neuropathy over the years. And it all starts with the beginning of the system. And the very first thing that we must do is we must find out, is the nervous system sending the appropriate electrical signals to the body to allow the body to absorb force? Because if it's not, that can be a contributing factor to the pain associated with this issue. So the first thing that we would do is when you come into one of our facilities, we will take you through a test that we call an external EMG, where we identify, is the nervous system sending the proper signal to your body? And if it's not, we utilize our proprietary tools and techniques to turn that switch back on to where that force now can be transferred out of the tissue that is bothering you into tissue that it should have been going to all along. So that would be the first step in our system. The second step is to identify exactly where the signal is coming from causing the pain. And we do that, again, utilizing our proprietary tool. We scan the body. We find out exactly where the signal is coming from, and it will be nowhere near where you think it is. So wherever you are experiencing pain, with your neuropathy, typically that is where the problem ended up. It is not where the problem is coming from. So with that in mind, what we want to do is we want to identify very, very quickly where the problem is coming from, because you can't solve the problem until you find out where it's coming from. So we will scan the body, and as we scan the body, we will find that spot where that signal is coming from. At that point in time, we are then going to go into treatment mode utilizing our proprietary techniques and our proprietary technology, and we will basically stimulate you as the patient with the diabetic neuropathy, and we will mimic movements that normally would bother you, whatever that movement is. And the reason we're going to mimic that movement is because we're going to begin to neurologically retrain the muscles necessary to perform that function more efficiently. We're going to train them to do their job. Because presently, right now, if you have pain, quite frankly, your muscles aren't doing what they're supposed to do. So you're complementing that by simply creating a compensation pattern. The way you move away from that pain is actually sending a signal that there's pain in that area. So we're going to break all of those patterns of movement. With that being said, once we've done that, we've now neurologically retrained your body on doing what it's supposed to do as opposed to what it has been doing. And the most important thing, this is not a temporary relief. This is a solution if it works. And again, there's only one way to know for sure if it works, and that is to try it. And again, to Mabel from Bozeman, Montana, we do have a facility in Bozeman, and if you give us a call at 954-256-0045, we will immediately get you set up to be treated at the facility in Bozeman. So the answer to the question, do I think we can help with diabetic neuropathy? Yes, I do. Unless there's some extenuating circumstances. Based on past performances, I can almost assure you that we can make a significant change in your quality of life. But again, I'm not here to diagnose anything. I'm not here to give free medical advice because I'm not a medical doctor. But I can tell you, over the last 15 years, we've been extraordinarily successful in treating the condition of diabetic neuropathy. Now, is it a panacea? Does it work on everybody? No, absolutely not. That's why we give you the opportunity of seeing if it can help you at no cost and no obligation. So if you're listening in the Miami Beach area and you have been diagnosed with diabetic neuropathy and you would like to see if neurotherapy can help you, give us a call at 954-256-0045. And we will set you up with your doctor or a doctor in your area. So if your doctor agrees to allow us to treat you at no cost and no obligation to either of you to see if this therapy can help, that is our primary purpose. Now, if your doctor says, no, I really don't want to do that, I don't know enough about it, they don't have enough studies, whatever the answer is, if the doctor is not interested in having us treat you in his or her office, we will certainly set you up with one of the doctors in the area who are our providers. So providers, doctors, medical professionals, if you're listening to this, you're in the Miami Beach area, I would love to have the opportunity of meeting you, talking over with you, answering all your questions pertinent to neurotherapy. And again, we'll be at the Miami Beach Convention Center from Wednesday through Friday. You can simply give us a call at 954-256-0045, and we would be more than happy to get you a VIP pass. You can come to our booth. Our booth number is 2592. That's 2592. I will be there treating patients pretty much the entire week. We'll have many, many doctors there. So it will be a very enlightening experience. Our booth number again is 2592, and I will be at the Miami Beach Convention Center from Wednesday through Friday. Friday afternoon I speak at the conference, and then Friday evening I leave. So I will be there Wednesday through Friday. Be happy to meet you, happy to answer any questions you have. Doctors, if you have patients that you would like to see if the neurotherapy can help, please bring them in. We'd be more than happy to treat them. Again, no cost, no obligation to you, and you will see firsthand how neurotherapy can be a tremendous addition to your practice. So, the answer to the question about diabetic neuropathy, yes, I think we can help. But again, there's only one way we're ever going to know for sure, and that's to try it. And if it's no cost, there's no obligation, then why in the world wouldn't you try it? Why in the world wouldn't you want to see if you could change your quality of life? It baffles me why people constantly ask me questions, and when I give them the answer and say, look, there's only one way you're ever going to know if it's going to help, and that's to try it. Now, the overwhelming majority of people do take me up on that offer, but there's still some who say, well, I think I'd just rather stay this way. I just don't understand that. So our mission is to help as many people as we possibly can. Our mission is to train as many doctors and medical professionals throughout the world to administer neurotherapy in their practice. Listen carefully now to how you can find out more about neurotherapy.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website, www.painmanagementnetwork.com, and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson. And earlier we were talking about diabetic neuropathy. I have another question here from a listener in, it looks like DeLand, Florida. And the question here is, can the ARP Wave System neurotherapy help me with chronic pain? Well, if you've been listening to the show for the last 6 or 7 weeks, we talked in quite detail about chronic pain. And yes, I do believe that the ARP Wave System neurotherapy can help you. But again, there's only one way to know for sure if it can, and that's to try it. And if it costs you absolutely nothing, then why not do it? So the first step I would have you do is contact your doctor. Ask your doctor locally in DeLand there if he would be or she would be interested in having you be treated with neurotherapy in their office. And if they are interested, what we'll do is we'll set up a time that's convenient for the both of you. We'll have one of our representatives come out to the doctor's office, and we will take you step by step through the ARP Wave System neurotherapy. And at the end of that 30 to 40-minute session, where there's no cost to you at all, you'll know beyond a shadow of a doubt if we can help you or not. And my guess is that we will be able to help you. Now, why am I so sure of that? Well, like I said earlier, we've treated well in excess of 75,000 patients, many of whom were diagnosed with chronic pain, many of whom were basically told that they had to take medication for the rest of their life to have any quality of life. So what I tell anyone with chronic pain is, I have no idea if we're going to be able to help you or not. My instincts say yes, but again, until you go through one session, you'll never know, nor will we, if we can help you. So if you're listening in the Miami-Dade area, again, we're going to be at the Miami Beach Convention Center all this week, starting Wednesday through Friday. We'll have a booth at the conference. Our booth number is 2592. If you'd like to meet me, if you'd like to see neurotherapy, if you'd like to have any questions answered about neurotherapy, just give us a call locally at 954-256-0045, and we'll get you VIP passes to the show. And this is a very, very large medical convention, and there will be thousands and thousands of doctors there. And what we will be doing is setting up many of those doctors to be providers of neurotherapy throughout the entire world. So I'd love to have the opportunity to see if we can help you. Because if we can, great. You're going to tell a lot of people that we were able to help you. And if we can't, hey, we'll part friends. But at least we'll know beyond a shadow of a doubt if we can or we can't help you. So why is chronic pain such a major problem? Well, it's a problem because wherever you have pain is where the problem ended up, not where it's coming from. This is what our statistics tell us. This is what our studies tell us. This is what our experience tells us. So we've created a method by which we can identify where that pain is coming from. And we use a very unique, highly proprietary system to find out the neurological origin of the physiological symptom. Now, that's a mouthful, but what it means is wherever you have pain is where the problem ended, not where it's coming from. We find out where it's coming from. Until you can find out where it's coming from, you'll never, ever solve the problem. That's why when you hear people that have chronic pain or chronic issues, they always keep coming back. The issue keeps coming back because what we do traditionally is we address the symptoms of the problem. With neurotherapy, we're addressing the origin of the problem, and it's a very, very unique process. I'll give you an example. I was dealing with a doctor in Canada last week, and this gentleman is world-renowned as a pain specialist. He speaks throughout the entire world on pain. He brought his wife in to have a free evaluation, and we did that over Skype, where I met he and his wife and his staff, and it was a training session to see if we could make a change in his wife's condition. Now, keep in mind, this is a world-renowned pain specialist. His wife has had back pain for the last 17 years. And she's a beautiful woman, very active, doesn't let the pain stop her from her activities, but he traditionally treats her through a variety of means, medication, shots, et cetera, and it always helps her for a period of time, and then the problem comes back. She was unable to bend backwards without pain of anywhere from 7 or 8. She was unable to touch her knees, not her toes, her knees, without pain of 7 or 8. But when she's walking around and doing just normal day-to-day activity, unless she bends forward or bends backward, she doesn't have a great deal of pain. She typically told me it was probably around a 3 or a 4. So I asked her what movement bothered her the most, and she said, by far, back bend would bother her the most. So in about 40 minutes, we had taken her through the initial ARP Wave System neurotherapy treatment and evaluation. And at the end of the treatment and the evaluation, she bent over and touched her toes. She did a back bend. She had absolutely zero pain. And the doctor was completely amazed and said these words: "This is a complete new paradigm in pain management. I've never seen anything like this." And he's 100% correct. Because understand, as gifted and as intelligent and as educated as this doctor is, he was and is educated in physical medicine, not neurology of that problem, only the physiology of that problem. So with that in mind, all we did is work on the neurology of the problem, and immediately the muscles responded to the stimuli that we were giving this young lady. Now, a follow-up on that, and this is very interesting, I got a call from him. This was Wednesday of last week. I got a call from him over the weekend, and he said, "My wife has followed through with the treatment. She's on treatment number 4, and today she went out and played tennis and had absolutely no pain." That's the first time she's been able to do any activity over and above walking without considerable pain. Thank you very much for this amazing new therapy. Now, that doctor got it. But you know what? I tried for 3.5 years to get his attention. And after 3.5 years of communicating back and forth, he said, "Okay, fine. Let me try it. I've talked to Dr. So-and-so, I've talked to Dr. So-and-so, I've talked to Dr. So-and-so. They all say I need to try it, so let me try it." He now will probably become one of our biggest advocates. Now, this is a world-renowned specialist. So if you listening out there have pain, why in the world would you want to continue a life of taking medication and restricting your activity just to satisfy the diagnoses of chronic pain? Maybe there's another solution. I'm not saying we have that solution. I'm saying you've got absolutely nothing to lose to see if we can help you, and absolutely everything to gain. Now, whether you're a practitioner or whether you are a prospective patient, there's only one way you're ever going to know if this therapy can help you, and that's to try it. You must experience this. I can talk until I'm blue in the face, but until you try it, you'll never, ever, ever believe it can do what it is capable of doing. Keep in mind, we are working on the software system that drives everything in your body. Just by that statement alone, it should tell you that there is a potential of being able to help you, especially if you've been diagnosed with chronic pain. If you have fibromyalgia, if you have CRPS, which used to be called RSD, if you have chronic pain syndrome, you owe it to yourself to see if neurotherapy can help you. Call your doctor. Ask your doctor if he offers neurotherapy. If he or she does not, tell them you'd like to be treated with it. Give us a call at 954-256-0045, and we'll set that up for you in your doctor's office. If you're interested this week in being treated, and if you're interested this week in meeting me and my staff, we will be at the Miami Beach Convention Center at the FIME show. It's a major international medical show. We're in booth 2592. We'll be treating doctors. We'll be treating doctors' patients. And I will be introducing neurotherapy to the audience on Friday afternoon. So I personally will be in the booth at the Miami Beach Convention Center, booth 2592, Wednesday through Friday. So if you are a practitioner or if you are a patient, please give us a call at 954-256-0045. We can get you VIP passes, and I believe the passes are something like $70, $80, so we'll get you those free. You can come in, you can meet me, you can meet our staff, and most importantly, you can see if neurotherapy can help you. So with that in mind, I would strongly suggest if you're in the local area, just give us a call. That number again is 954-256-0045. Find out for yourself if neurotherapy can help you. There's not a shadow of a doubt in my mind that it can do it, but there's only one way you're ever going to know, and that's to try it. And since we've taken all the risk away, since you know it cannot possibly harm you, since you don't know if it's going to help you, try it. And again, if you'd like to meet us personally, we'll be at the Miami Beach Convention Center Wednesday through Friday of this week. And our booth number there is 2592.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com. neurological.com and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson. And I have another question from a gentleman by the name of Kevin out of Lake Worth, Florida. And Kevin is asking, can the ARP Wave System neurotherapy help someone who's been diagnosed with a herniated disc? And in your opinion, what causes a herniated disc? Since I've been listening to your show for the last 3 weeks, and you're consistently talking about the cause as opposed to where the symptoms ended up. Well, Kevin, again, I'm not here to give free medical advice. I'm not a medical doctor. I do not diagnose anything. I can only tell you how we've been successful over the last 15 years in treating herniated discs. And I can also tell you beyond a shadow of a doubt that the ARP Wave System neurotherapy will get to the bottom of the problem very, very quickly. So let's talk about herniated disc. So what caused it? Obviously, an injury, an accident of some kind would be the normal answer to that question, when in reality, that is not at all the cause. The cause is the force went to that area and it bypassed where it was supposed to go, which is the muscles. So the muscles in the back did not do their job. It doesn't mean the muscles in the back are not strong. It just means those muscles didn't neurologically turn on fast enough to absorb the forces coming into the body. And typically, unless you are in an automobile accident or some form of major, major trauma, which is causing that problem, the problem really isn't what we think it is. The problem, quite frankly, is the body's nervous energy is not getting appropriately to the muscles to allow them to turn on fast enough to act as shock absorbers. So, Kevin, think of it this way. Your muscles in your back are shock absorbers. Your muscles in your legs are shock absorbers. If those shock absorbers don't work, the shock is going to go into your body to places where it's not designed to go. And in your case, obviously, it went directly into your back. Now, as that force consistently keeps going into areas not designed to go to, it's going to create damage. So I tell all our patients that we treat and that our doctors treat is a simple analogy. Take a jelly donut, put it on the table, and put your hand over the top of the jelly donut and push down on it. What happens? Jelly comes out. Take your hand off, what happens? The pressure's gone. So the pain caused by a herniated disc is the force going consistently into that area. What do you think would happen if you redirected the force? If you got the force out of the damaged tissue and you put it over into muscles that were, say, in the legs? Let's say you directed the force out of the back and put it back in the legs. What do you think would happen to the pain in your back? Well, the answer is it would go away. Now, the trouble with that statement is, Kevin, you can't do that on your own. The reason you can't do that on your own is because that is not a physiological solution. It is a neurological solution. And what that means is that your nervous system drives your muscles. And if they don't turn on fast enough to absorb the force is going to go right to where it's been going. And no amount of therapy is going to change the fact that the force keeps going to that area. The only thing that's going to change that is to change the signal and redirect the force. And that's exactly what neurotherapy does. It changes the signal and redirects the force. So if you have force consistently going into your back, is it any wonder that every time you move, every time you twist, every time you stand up, that it hurts? Well, of course it's going to hurt, because all that force is going to that specific spot. Now imagine if you could take all that force and just instantly move it out of your back into, say, your hamstrings and your quads. Imagine what would happen when you stood up, where the force went into your legs instead of your back. Kevin, do you think you'd have pain? Of course, the answer is no. You're not going to have pain. Now, what's it going to do for the herniation? Well, nothing. What it's going to do is redirect the force, take the tension off the muscles that have been protecting you, just like removing your hand off of a jelly donut. You're not going to push any more jelly down. So now what happens is, now that tissue can heal because there's not constant force going into that area, and only then will that tissue heal. As long as there's force going into that area, that tissue will not heal. And so you can take all the medication in the world, you've done absolutely nothing to solve the problem. All you've done is hide the problem, Kevin, and you've been doing this for years and years and years. Now, I know what I say sounds incredibly hard to believe, but stop and think about one thing. If you have force consistently going into an area, in other words, you have dedicated force going directly to that area, tension in that area, friction in that area, do you believe that area is going to heal? No. It's impossible. Why? Because there's a constant disruption going on. What if there's no disruption? What if all of a sudden there's no disruption? Kevin, do you think that that would heal? Of course it will. So what the ARP Wave System neurotherapy does is it identifies where the signal is coming from, causing the pain. It redirects the force out of the area where it's going to now and puts it into an area that it should have been going to all along. In this case, it should have been going to your legs, and Kevin, I can guarantee you it's not. It's going to your back. So what the neurotherapy is going to do is it's going to neurologically retrain your muscles to take the force out of your back and put it into your legs. Therefore, you're going to increase blood supply to the affected area. You're going to take force out of the affected area. And based upon those two principles, most doctors in the world will agree that tissue will heal quickly. The problem with that statement is it is not a physiological solution. It is purely a neurological solution. And most doctors, not all, but most doctors who are treating you for a herniated disc are not trained in the neurology of force absorption and are not trained on how to redirect that force neurologically and are not trained on how to neurologically retrain the muscles to do what they're supposed to do. So, is neurotherapy a good addition to a doctor's practice? Absolutely. Does it replace what the doctor's doing? Absolutely not. It is an add-on. It is not a subtraction. It is a way of addressing the electrical signals causing the physiological pain. No matter where that pain is, no matter where it came from, the bottom line is there's an electrical signal that's causing that pain and causing your muscles, Kevin, to react the way they are right now. So can the ARP Wave System neurotherapy help you? I have no idea. I have a pretty good feeling that we can help you because we've helped thousands and thousands just like you. But there's only one way you're ever going to know, Kevin, if this can help you, if neurotherapy can help you, and that's to give us a call. Now, what I would strongly suggest is get your doctor, call him or her, and tell them that you would like to be treated with neurotherapy. You heard about it on the radio show. Invite them to listen to the show, and invite them the opportunity of having you treated with one of our therapists in their office right in your area. And at the end of that treatment, if it does what I think it'll do, Kevin, then all I want you to do is tell the doctor, hey, this worked and I'd like to get this treatment here in your office. And doctor, if Kevin says that to you, then I would expect you to join our network and be one of our providers, because we have patients upon patients upon patients who need neurotherapy. Listen carefully. Until next week, this is Dennis Thompson, your host. You've been listening to Pain Free Today.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.